In this video, we are going to expound on the hormones of the endocrine system, their functions and disorders associated with them. Cortisol. Cortisol is a glucocorticoid that is considered a stress hormone. It's more of an acute stress hormone than a chronic. An example of a stress is something that occurs all of a sudden, and a chronic stress is something that is long-term. If one has elevated cortisol levels for a long period of time, it could lead to decreased immunity, increased blood pressure, and high levels of glucose in the bloodstream. Functions include regulating metabolism, immune response, and body's response to stress. What controls the cortisol? It starts in the hypothalamus. The hypothalamus will produce CRH, which causes the release of CTH from the arterial pituitary gland, and then this causes the release of cortisol from the adrenal cortex. Disorders caused by cortisol irregularities, Cushing's syndrome, which is elevated cortisol levels, and Addison disease, which is a decrease in the level of cortisol in the body. Thyroid hormones. When we talk about the thyroid hormones, we talk about the T3 and the T4. T3 is the active form of T4. Thyroid hormones control various functions in the body. That includes metabolism, growth and development, heart function, brain function, muscle function, digestive, and bone maintenance. Disorders caused by thyroid irregularities include hyperthyroidism, which is elevated levels of thyroid, and hypothyroidism, which is decreased levels of thyroid. The control of thyroid hormone starts from the hypothalamus. The hypothalamus produces TRH, which causes the arterial pituitary gland to produce TSH, which allows for the production of T3 and T4 in the thyroid gland. Growth hormone. Another name for the growth hormone is somatostatin. Growth hormone controls growth and metabolism in the body. It also controls protein synthesis. The control of growth hormone starts in the brain, which is the hypothalamus. The hypothalamus will produce GHRH, which causes growth hormone to be produced in the arterial pituitary gland. Estrogen. Estrogen is a hormone that stimulates the development of the female sex organs, and it's also instrumental in the regulation of menstrual period. Estrogen release starts from the hypothalamus, which produces GRH, which releases LH and FSH to be produced in the arterial pituitary gland, and that allows for production of estrogen in the ovaries. Progesterone. Progesterone plays a key role in regulating menstrual cycles and plays also a role in the maintenance of pregnancy. Its production starts from the hypothalamus, where it releases the GRH. This causes the LH to be released from the arterial pituitary gland. This allows for progesterone to be produced in the ovaries. Testosterone. Testosterone helps to stimulate the development of male sex organs, and it also is instrumental in sperm production. Its production starts in the hypothalamus, where the GRH is produced, which causes FSH and LH to be produced in the arterial pituitary gland. This allows for sperm and testosterone production in the testes. Oxytocin. In the female, it causes contraction of the uterus and also promotes lactation. In males, it controls production of testosterone as well as sperm release. It is controlled with the positive feedback. Most hormones in the endocrine system are controlled with the negative. Prolactin. Prolactin is the primary hormone that promotes lactation. It's released from the arterial pituitary gland. Levels of prolactin in the body are controlled by dopamine and estrogen and other hormones circulating in the body. ADH. It helps to control blood pressure and blood volume in the body by regulating the reabsorption and excretion of water in the kidneys. More ADH causes more reabsorption of H2O, and low ADH causes more excretion of H2O. ADH is secreted from the posterior pituitary gland in response to three things. 1. low blood volume, hypovolemia. 2, low blood pressure, hypotension. 3, hypernatremia, which is elevated sodium levels. Aldosterone. It is a hormone that increases blood volume and blood pressure by causing kidney reabsorption of both water and sodium and the excretion of potassium. The release of aldosterone is controlled by the renin-angiotensinogen aldosterone system, the RAS system. Epinephrine and norepinephrine. There are coltonomies. They are released by the adrenal medulla, the inside of adrenal gland. They are responsible for acute stress, which is the fight and flight response. They cause various number of changes in the body: vasoconstriction, increased blood pressure and heart rate, increased blood flow to the muscles, bronchodilation, pupil dilation, increased blood glucose levels. Epinephrine has more effect on the heart versus norepinephrine, which has more of the effect on the blood vessels. Controls of the epinephrine and norepinephrine are: when one has an acute stress or situation, the sympathetic nervous system is activated, which activates nerves that are connected to the adrenal medulla, which allows for secretion of both epinephrine and norepinephrine. Calcitonin. It is a hormone that decreases blood calcium levels. It's opposite to the action of the parathyroid hormone. It decreases blood calcium levels by: 1, decreasing the activity of osteoclasts. 2, it increases the excretion of calcium at the kidneys. The release of calcitonin occurs when the body senses that there is too much calcium, hypercalcemia, in the blood serum. It stimulates the release of calcitonin from the thyroid. Parathyroid hormone. It does the opposite of what calcitonin does. The parathyroid hormone increases the amount of calcium in the body. It does this by: 1, pulls calcium out of the bones into the bloodstream. 2, causes the kidneys to reabsorb more calcium and causes the kidneys to release vitamin D, which is crucial in the absorption of calcium. It also increases absorption of calcium in the intestines. PTH is released when the body senses there is not enough calcium, hypocalcemia, in the bloodstream. It stimulates the release of PTH from the parathyroid gland. Insulin and glucagon. Insulin decreases blood glucose level. It allows the movement of glucose from the bloodstream into the blood cells, where it can be used for energy. When the body senses the blood glucose level is rising, insulin is released from the beta cells in the pancreas to help escort the glucose into the blood cells. Glucagon increases blood glucose levels by: it causes the adipose tissue to break down fat for the use of energy. It causes glycogenesis, which is the production of new glucose. And it also causes glycogenolysis, which is the conversion of glycogen in the liver into glucose, then releasing it into the bloodstream. Bonus: negative feedback and positive feedback mechanism. Most hormones in the body are controlled by the negative. The negative feedback mechanism works similarly to a thermostat. For example, if the endocrine glands senses that there is too much of a hormone circulating in the body, it will initiate changes to decrease production of that hormone and vice versa in order to maintain homeostasis of hormones circulating in the body. For example, the release of T3 and T4. So when the body senses there is an increased level of T3 and T4 in the body, there will be a decreased production of TSH. And when there is an increase in TSH, that means the T3 and T levels are low. With a positive feedback, when you release a certain hormone, that causes additional release of that same hormone. For example, with oxytocin, oxytocin allows for uterine contractions when somebody wants to give birth. And when there is uterine contraction, this causes more oxytocin to be released in the body. Thank you for watching. Please like, share, and subscribe to my channel See you on the next one. Bye.